record in video. Alright, so welcome to Restorative, everybody. Today we're doing basically I'll call it my buffet of my favorite restorative poses. That's the theme. And there's been a request to work on our feet, so we're going to get started with a self-massage at the feet. You'll need at least one ball. And before we rub out the feet, take a forward fold so you can have your knees soft, and you can just hinge down from your hips and just fold over in any amount that's comfortable, and just feel into the contact of your feet, into the back of your legs, calves, the hamstrings, the hips, and even the back. Like, what's the condition of these tissues right now? And then you can either draw your belly in and roll up, stacking your vertebrae one at a time, or you can hinge up with a neutral spine. And we're going to take one of the balls. I need to move this so I can record the ball position better. And we are going to start with the ball, basically under the ball of your foot, so that padded part of your foot. And you're going to press and release into the bones and into the space between all the toe bones. So encouraging your toe bones to start to spread and move. So we tend to lock up our feet into these boxes called shoes, and it really, over a lifetime, obviously hinders the mobility of the feet, and that can have consequences for our gait, our balance, etc. Not to mention our toe alignment. It's really not uncommon for us to start having our toes kind of curl around each other from wearing shoes that are too tight. So we're trying to articulate and move these bones and joints better. And then you can continue that push and release to talk to all of the bones and joints. So you can get off of the ball of the foot as well. And just do this push and release all the way down towards your heel. And it's also a good way for you to assess and feel what's going on in the muscles and the tissues of this foot. If it's super sensitive, err on being a little bit more gentle, especially if it's your first time. We don't want to inflame tissues that are already inflamed. So we would have to do the self-massage a little bit more gently for it. Okay. And then you come back to the ball of your foot with your heel down, and you roll the ball across your transverse arch. Trying to keep your heel down so you're getting your ankle to move as well. Good. And then start to roll up and down along your foot. And you can intend for the ball to go up towards the big toe, back down towards the heel, up towards the middle toe, and so on. So getting the vertical roll through all of the 5 toes at least a couple of times. And then focus on the inner arch. So rubbing along that inner arch as well. And then also focusing on the outer arch, which is not as pronounced, but there is a slight elevation through there, and the convergence of all these three arches creates a little bit of a dome in our foot, and that helps the bones to carry the load of the body more effectively than if they were obviously flat. Okay, and then park the ball in the center of your foot. And again, evert and invert your foot. Roll to the outer, roll to the inner edge of the foot. And then go also towards the heel's edge with your toes down and rub out across at the attachment of your connective tissue to the heel bone. And then you can step down, take a pause, and just feel the difference between how the foot that you rubbed out is landing with the floor, the one that you haven't. And then you can take your forward fold check again, coming down into your second forward fold, and just take a moment to feel the difference between the leg that you rubbed out and the one that you haven't, and then all the way up through the body, from the feet into the hips into the low back. Whatever you can feel is valuable information developing that proprioception. And then again, hinge up or roll up, your choice. If you have a set of the yoga balls, then I recommend using the other ball so that you're wearing them down evenly. But if you only have one ball, then obviously just use that one again. And we start again at the under the padded fleshy part of your foot, the ball of your foot. And you're intending right here to push and release. To first, you can do it on the toe bones itself, some of those joints, and you can do it between the toe bones to allow the toe bones to spread. So either places are helpful. And there's also a self-assessment to feel what's going on with the tissues in this foot. Maybe one side is a little different than the other. And then continue with this push and release all the way down your foot. You might even get some cracks here and there. And then come back to the transverse arch at the ball of the foot, and kind of move the foot around so that you feel that bony edge, and roll the ball across. Yeah, so keep your heel down and pivot towards the inner edge of your foot, pivot towards the outer edge of your foot in an amount that works for your ankle. So we're also encouraging movement in the ankle here. Okay. And then also roll up and down. So go all the way up and down your foot. You can be more systematic and try to go through toe bone. It's a little bit of a balance challenge as well. And then rub out your inner arch space. So right along that inner arch, you can put more pressure if you like, or less. You could even stay at that inner arch and just push down and breathe. And then go towards that outer arch area and see if you can find that bony edge of your outer arch. And then park the ball in the center of your foot and try to stretch your heel down. You might feel your calf stretch, and if you want to deepen that, you can stack the leg bone so that it's all in the hips above the ankle. And you could even step the other foot more forward. So you're getting a little stretch through the calves. And then you can start to, again, roll side to side. And then last place is at that heel's edge with the toes down, and you're scrubbing sideways against the attachment of the plantar fascia to this heel bone. Cool. Then step down, feel how your feet land, and then find your forward fold again, and notice your legs, notice the whole back line of the body. If it has changed in any way, by loosening up the connective tissue of your feet. And then you can, if you want to, you can just kind of come down to the floor from here. You can walk your hands further away. You can lift your heels and lower your knees. And we'll tote those balls. Let's get some spinal movement before we come into our first restorative. So you can find spinal flexion, well, this is extension, and then flexion through your cat-cow. And you can start from the pelvis. So you can move your tailbone into a sad tail and letting your spine round. You can move your tailbone into a happy tail and letting that radiate up so that your spine goes more towards extension. And you can find, little places of micro movement. So sometimes I'll hang here in this cat position and just maybe head, maybe move the hips. And then another variation that I'm enjoying is I'll come up through extension and I'll turn my head to the side, adding in a little stretch through the neck. So you can let it be your exploration and add in little micro movements. Another variation that you can do is you can get more rib movement, more of I would say kind of like moving your spine like a jump rope. That's my description of it. So you're combining the flexion into a side bend, into the extension, into a side bend. You could also come down towards child's pose and come back forward. So make it your own. Explore what's going on in your back, your hips, and your neck. And then we will add that side bend. If you haven't already, you can find that neutral positioning. And then you can look towards your right hip and try to hike your hip towards your shoulder. To deepen that side bend, you can walk your hands to the right side more so that you stretch through that left side. And then again, you could stay and mobilize, maybe rotate the head and neck a little bit. And then walk your hands back through center. You can stretch back into neutral, into child's. Take a pause, feel the side bodies. Pull back, forward. Find a neutral spine, little more extension. And then look over towards your left hip and maybe hike that left hip up more. And then walk your hands to the left. Maybe hang out and breathe into the right side of your ribs and explore micro movements with the neck. Then coming back through center, stretching out into child's, maybe take a different variation. Arms can be wider. Take a breath here. And then we'll slide up and we're going to find that spinal rotation here. So you can lift that right hand. You can turn towards the right side and you can slide that arm. So I'm going to do the other side and lower down onto your right side of your head, your ear. And this is a variation that I've been playing with. So you can take what you could stay here. The variation that I've been playing with is if you're on the right side with your right side down, right shoulder down, you'll step your left leg out to the side. And this will help to deepen that turn. And you can push with the other hand and you can turn in a comfortable amount for your neck towards the ceiling. And then of course, if you want to load, change the load, you could lift the leg up, but you can make it more gentle with the foot down. And then come out of that twist and come back onto all fours. If you need to take a stretch out first, do so. And then do your second side. So it would be your left hand that lifts here, and then you would slide down. If your shoulder and head don't touch the floor, you can support them with your blanket. You can kick the other leg out and deepen your rotation. Breathe into the back of your ribs. And then come out of that rotation. Yeah, you can kneel back and just shake it out through the wrists, through the shoulders, just not letting tension accumulate in the upper body. Make little circles. Good. And then we will come into our first restorative. So you can grab 2 blankets and we're building a bolster. So folding them the long way to support you. It's okay. And we're coming into a prone belly down twist. So I'm going to start it on my left side, but you can start on either side. So from here, my left outer hip is facing the bottom of the bolster. My knees are together out to the side. And then I'm going to turn towards the bolster, lengthen my spine, and walk myself down. And the gaze is going to be over towards the legs. The variation that you can have your legs like this. The variation that I was playing with earlier is I'm kicking my bottom leg out. So I'm on the left. So my left leg is out. And then from here, pick up the left hip and depress it away from the bolster so you feel like your low back is lengthening out. Okay. And then what I was playing here is with lengthening the spine. So you can push the outer edge of your left leg into the floor and squeeze your inner thighs together. So it's like lengthen your spine and then push with your arms to rotate more towards the left side. Yeah, and then you could even turn your neck more if that feels good. And then you can release down. So I'm creating like axial extension, lengthening by depressing the hip down and lengthening my spine forward and then turning. And then I'll come down and make it more of a passive hold. Arms can be like this, the elbows bent. A variation on the left arm, the back arm, is to lengthen it by along the body with the hand palm up by the hip. And this is a great position to develop the breathing. So I think it's, getting out into popular media now. More people know that proning, lying on our belly, helps with the breathing. And that because the shape of the lungs, the bulk of the lungs are actually right here in this middle back area. So as you stay here, see if you can intend for the breath to move down into the lower part of your lungs. Move down into your middle back. And then slow down your exhale so that it is just as long as your inhale. The practice of restorative is very much a meditative practice. So as you stay, keep your awareness in the back body. Keep your awareness connected with the breath. And then whenever you notice that your attention wanders away from these objects, just notice what your tendency of mind is. It's normal for mind to leave. And then redirect your attention back into being fully present inside your body. And as you stay connected with this ebb and flow of your natural breath, giving thanks for its nurturance, giving thanks for how easy it is, how pleasurable it is to take full breath. Stay on this side for one more minute. And you sense how, with every exhalation, that you're allowing your body to settle into the bolster a little bit more deeply as well. Watch your body breathe for 3 more rounds here. Go with your own pace, your own timing. When you're ready to transition out, you can take the hands underneath your shoulders and you can gently support yourself up and listen to your body. Sometimes, if the muscles are, just feeling a little stiff, maybe you want to do a few rounds of cat cow in between. Maybe you want to stretch into a child's pose. So, whatever it is that you need to do in between to release if there is any tension, and then we'll make our way to the second side. So you'll have your other hip to the bolster. You can do it with both knees bent, or you can have the leg that's closest to the bolster straight. Take it out. Lengthen your spine as you rotate it towards the bolster and walk your hands further out and lower yourself down. And then once you're down with that long leg, you can pick up that hip and lengthen the hip away from the bolster to stretch through your waist more. You can activate that leg, so lengthen through that heel and press the leg into the floor. And you can squeeze your inner thighs together to fix the hip and then pull with your hands. There's a pull and a push so that you lengthen your spine away from your hips, and you can push into your right hand if you're on the right side to deepen the rotation. And that might feel good. And I just got a good crack. You can look over away from the legs. And then come out of that kind of deeper twist and return the head back to the leg side, and then come into the passive pose. So sometimes for some of us, maybe you want to do that twist, that active twist, a few more times if you're feeling called for that. And then once you are in stillness, come back to sensing the wave of your breath and intending for the breath to move through the back body. First, just feeling the way that the back muscles are being moved by your breath. And this can be very helpful if there is back tension, just allowing the breath to create this inner massage through the back muscles. It also helps to tone the vagus nerve, which is the main nerve of the relaxation response. When we develop this back breathing pattern, and then with that exhale, just sensing how your body softens and recoils inwardly, especially maybe in the belly, and allows you to sink into support more. And once you've connected with the more superficial structures of the back body, then intend now for your breath to also move down into your lungs, into the lower lobes of your lungs, noticing if it's easier to get movement into one side versus the other. Notice how this affects the depth of your breath when you make that intentional connection into the lungs. And then the last bit is just to feel when you um, are focusing on the breath. Sometimes the tendency is to make the inhale bigger. So feel for the relative length between inhale and exhale, and allow the exhale to lengthen if it is shorter than the inhale. Generally speaking, if the inhalation phase is longer, it is more of a sympathetic, more of an activating breathing pattern. When they're even, it is a pattern that helps to put us into homeostasis, into balance. And then when the exhalation is longer, it is more of a parasympathetic pattern. Feeling for the pleasure, gratitude of this breath. Recognizing really that we think on the inhale we're sucking in the air, but we're actually being filled by the atmospheric pressure that races down into our vacuum in our lungs. In a way, you could say that through the breath we are participating with life. We are being filled by the atmosphere, by all the trees, plants. Let's stay here for one more minute. You can let go of all active control, intention, breath, and simply allow yourself to receive the breath as it is. Let yourself breathe for 3 more rounds here. More pace, more time. You're ready to come out. Transition the hands underneath shoulders, one step at a time, and just tune into your body. You need to do any counter movement with your back, your spine. So you can come back to those stretches that we did earlier as a release. And then we're going to come into, I'm going to give you a few options for this. It's kind of a heart opener, but the intention is also to stretch through this area. So the upper fibers of your psoas. And you can use the setup, so that's option 1. So you can use this setup to be in the pose, or if you want like a bigger heart opener, you can use 2 blocks instead. So I'll show you the setup in the bolster. So if you're doing the bolster, it's a supine position. That means you're on your back, and you want to have your heart on the edge right here, and you want your head a little bit higher. So you can grab your 3rd blanket or a cushion to elevate the head. So your heart would be here, and your floating ribs would be kind of up, and so this, and then your belly would be, your belly, and your butt will be down. So it's kind of like right at the bra strap, that edge. So it stretches through this space, and what we're after is eventually, so usually when we come in, we might be like popping our ribs up like this, and then as we stay, we want to cultivate this capacity for the ribs to relax. So that's option 1. And then option 2, if you want a little bit more of a stretch, some people are really flexible, you could do with the blocks, and some people even go the long way, which is even more intense on the spine. So it's really up to your body. Try to find them. Oops. Yeah. Block something like this, and the block, if you're doing the middle one across, it should be underneath your shoulder blades. So here, it's going to cultivate the expansion of the ribs more on the inhale, which is this positioning. Getting a sense of your rib breath. And then on the exhalation, take your awareness to your spine from in the lumbar, in the low back. So below the ribs, all the way down towards your pelvis. On that exhale, can you get a sense of this part of your spine beginning to soften and release downwardly? We're going to add a sounding in order to cultivate the exhale, in order to also elicit more relaxation in that psoas. So that the muscle, the psoas, attaches to your vertebral bodies, your spine, lower spine in the front, and then it goes and wraps around the hip and attaches to your leg bone. So on the exhale, you can direct this sound to your psoas in the upper part of your low back. You can add touch, so I'm touching right below the rib angle on the upper part of the belly. And obviously the psoas is very deep, so but it helps me to locate it a little bit more. So imagining it's in front of the spine. And the psoas is very much connected to our nervous system. When we're under chronic stress, anxiety, it tends to tighten up more, and you want to gently cultivate opening, relaxing in this tissue without force. So doing that sound, and then it's actually helpful to like receive a regular breath in between the sound. And you might notice when you add in that sounding that it allows your inhalation deeper, more profound. You might notice the tissues begin to soften a little bit more easily. Let go of all active work here. Haven't already. And just again, simply receive the breath here, shape. Welcoming that inhalation and allowing that exhalation to soften your back body towards the earth more. your body here for 3 more rounds of your breath. You're pretty low down, not on the block, you're on blankets. It might feel comfortable to just bend the knees and just roll over to the side to come out. But if it feels like your back is arched too much or your back muscles are kind of tense, to come out like that, just press through your hands and sit up better. Maybe make some movements, rounding in that middle back and opening, maybe using the elbows or circles. So loosen up. And for the last pose today, I'm recommending inverted position. So you can either rest your legs up the couch, rest your legs up a wall, any way of supporting your legs up higher than your trunk. And the variation that you can choose is you can also put your sacrum on an elevation as well. So it could be a blanket or it could be a block so that even your pelvis is higher than your heart. So it'd be like legs highest, hips higher, or higher, and then the heart will be the lowest. I'm gonna try with my chair today, see how that works. I have a folding chair and it's got a hard surface, so it would be helpful to hook a blanket on the seat so that the knees aren't resting against a hard edge. And then I'm going to elevate my sacrum on a blanket. So this is my setup today. And then sit on that blanket and lower myself down. And depending on your size and your chair size, you might have to, if you've got long legs, you might have to put more blankets up, etc. So you want to be like Goldilocks and make it feel just right. The thing we want to watch out for the pelvis if we're at the wall or anywhere is we don't want to do this thing. We don't want to be in sad tail, and we don't want the sacrum hanging in the air. So if, let's say, your legs are at the wall and you're so close in, it's hanging up in the air, move further away, and also allow your pelvis to be more in neutral, more of a happy tail rather than a sad tail, because it's really going to tighten up the pelvic floor and disturb the breathing. Oh, and then we're going to add in a little tapping on the inner thighs. So just one of the things that an inverted position does is it helps to bring the venal blood back, and it helps with lymphatic drainage. And in order to deepen that effective lymphatic drainage, we're going to tap along the inner thighs because there's lymph there. We're going to tap along the leg, inner thigh a little more, and then the other leg. And then you could even give yourself a little belly rub, so there's lymph around there as well. And we also have a lot of lymph around the underarms, around the chest area. And you could make kind of like circles with your arms. You stretch your arms up and just get a little more movement into this space. And if you feel like it, you could also just like squeeze and give yourself a little massage through the underarms, chest, and massage your chest around your collarbones. Then, when you're done with that lymph stimulation, you can come to stillness. And we did a lot of breath focus, cultivating different avenues of breath. And here, as you stay, simply receive your natural breath. It's letting your attention and your mind rest into that natural ebb and flow of your breath's rhythm right now. And see if you can detect the natural back breath, the natural way that your inhale is already moving through and down your back body. Can you sense the way that this breath descends down through your spine and even into your sacrum, tailbone? And feeling how your natural breath is also expanding laterally from the heart and the lungs out into the sides of the ribs. It's also expanding from the center out to the front and out into the back. It's natural chest resting. And imagine that your breath stretches down into the lower lobes of your lungs. getting a sense how the lungs are elastic and they expand that inhalation. Quality of softness, filling and exhalation. The lungs, chest, ribs. And lastly, sensing quality of heart, spirit, breath. Quality nourish you in this moment that perhaps is already nourished. Quality of peace, quality of ease, calmness. Feel for that quality of vibrating presence. To memory, to inner guilt. And yourself to see what feel like you need to rest more. You're welcome to stay longer as you need to. Get ready to come out. You can initiate your movements first. Find yourself into a comfortable seat. Notice the quality of your beingness now. More, it's one way you could call it is superficial, or just notice the more dynamic aspects of movement. So the movement, the sensation of body, the movement, the sensation of breath, the movement, the sensation of thought, motion. Notice the sea that contains spaciousness, And letting your awareness expand out. Recognizing all spaciousness itself. One gateway into presence is through your heart, attention, heart, place the hands together, breath into heart center, bowing your head to the light in me honors the light in. Namaste. Thank you for taking the time out to cultivate peace and presence in your body, in your mind. If you want to begin, you can unmute yourself.
Thank you.
My pleasure. Good to see you.
Thank you so much.
Thank you.
Awesome.
Pleasure. How's everybody holding up?
Better now.
Yeah.
How about
So,
you?
we're, we don't have any complaints in the sense that personally, like, Charlie still has a job. We'll see about next week. And, I'm actually working more. I'm working at the hospital, checking people's temperatures and making them wear masks I'm not in the main hospital where the COVID patients are. I'm just, over in the office buildings where, they're different patients, not anybody critical. So it's been in a way nice to just have more social. So yeah, I'm actually working more, which is good. And more and more people are wearing masks. Well, actually, in Decatur, everybody wears masks because it's the liberal bastion in Atlanta. But I hear in other parts it's a little bit touch and go. So
Your governor's got some strange ideas.
oh, did you say something about our governor?
Scott was remarking on your governor.
Yeah, I don't understand either. It's like, well, what are you doing?
Yeah, exactly.
Yeah.
Well, you have a good temperament for having to interact with someone who's not wearing it. I'm not quite sure I could keep my composure right now with people that aren't doing it. So
Yeah, well, most people who come in who don't have one is because, yeah, they're like, oh, I don't have one. But we give them out to people. And so now I've been doing it for like maybe a month, and there's definitely less and less. And then, yeah, like in all the shopping that I do, I would say like 95% of people have masks on. So that's good.
good.
Yeah.
Yeah, it's pretty good here now. Too. I just went to 2 places today. Both of the places had mask signs outside and inside the store, and one of the places limited number of people inside the store and had mask requirement signs all over the place. And everybody was doing it.
Yeah. I think
I think if we want our schools to reopen, we have to shut things down again. I think restaurants restaurants need to close, maybe even for takeout, definitely not for even outdoor dining. I think if they want the schools to reopen, if we clamp down, you know, and are really hardcore for a few weeks, I think, you know, we might do okay. But I don't know.
It's certainly an uncertain time, what's ahead.
Yeah, I think the problem, lots of uncertainty, and thing that I try to remember is just to, like, I remember, you know, from yoga therapy, the philosophy is that working, I mean, obviously we want to meet ourselves where we're at. So if we're being triggered and there's physical pain, like, we want to address that. But ultimately, you know, the yogis say that it's the thinking that on the subtle level is what eventually manifests into, you know, the gross level. And so if we can cultivate a calm, peaceful state of mind, and then hopefully that can allow us to take actions that are of more benefit for others and ourselves. And, you know, like, it's so easy to get drawn into all the hysteria and the fear and the acrimony. So I just feel like the best contribution that I can personally make is to not buy into the fear and the acrimony, because, and we all know that if we have a body, that we're eventually, the body will die. So taking this broad view that, you know, this is not, you know, it's like, yeah, I think having a broad view of all of it and creating more time to connect with source will help us all.
Yep.
Yeah, other than that, I have no other answers.
You're doing it every week.
And I think teaching people how to breathe better will be helpful right now too. You know, I think it's really helpful because, we're gonna head to flu season, and so we need to have some practices for wellness and immunity and all of that too.
Thank you. I've got to go.
Okay, bye, Jennifer.
All right.
Bye.
Big hug to everybody. Stay safe. Stay sane.
All right.
That's
Have a